In one of his more aggressive moves yet to remake the nation's vaccine policy, Health Secretary Robert F. Kennedy Jr. announced he's removed, or in his words, retired, all 17 of the independent experts on a panel that advises the CDC on who should get what shots. In a Wall Street Journal op-ed, Kennedy wrote, "The committee has been plagued with persistent conflicts of interest and has become little more than a rubber stamp for any vaccine." Who he will pick to replace them, however, and whether they'll share Kennedy's skepticism is an open question. I want to bring in Dr. Ashish Jha, former White House COVID-19 response coordinator and dean of the Brown University School of Public Health. Doctor, I want to understand, first of all, I'm not in this industry. A lot of our viewers aren't. What is this panel? What did it do? And what are the implications of this move?
Yeah, well, first of all, thanks for having me back. This is a panel of experts that shapes what vaccines, if any, are going to be available to the American people. And what you saw yesterday was Robert F. Kennedy basically making up a lot of nonsense, lying about this panel, saying that it's rife with conflicts. It's not. They go through a very vigorous vetting. And they are some of our nation's experts on vaccines. And so this move is very, very concerning in terms of what this means for vaccine availability moving forward.
But I want to ask you, is there a difference between vaccine skepticism and vaccine denial? I mean, should there be a healthy dose of skepticism in any of this stuff? I mean, Kennedy claims it's about restoring trust in public agencies. And, there's also this concern that there's this revolving door with pharma people coming in, being put on this board. The optics of it, I think, are a little bit understandable. Kennedy has said that new members of the committee, quote, won't directly work for the vaccine industry and will foster a culture of critical inquiry, unafraid to ask hard questions. What is your take on that? And yeah, go ahead. Yeah. Sorry.
That all sounds great. And let's be very clear about actual facts. So he's removing, for instance, a nurse who has spent her whole life working on vaccines in Illinois, based on all the disclosures, has never worked with pharma, has not an employee of pharma. So this whole revolving door problem is an FDA problem. It's not a CDC advisory panel problem. He is conflating different issues to bring different challenges here. And all this stuff about all these people are conflicted. Look, there are very, very vigorous vetting policies that have been around for years. They were used in the Trump administration in the past. They were used in the Biden administration. So unless he has specific concerns he's raising about individuals, most of what he's saying is just nonsense. He's making it up. It's not true. And he's using it as pretext to fire the people who are going to basically shape what vaccines are available. If you take a step back, look at this. The autism stuff that's been debunked that he's now raising again, if you look at the way he's been handling the measles outbreak, you can't help but worry that what RFK Jr. is doing is he's making it harder and harder for kids to get vaccines in the future and for the elderly to get vaccines in the future. That's where this is heading. This is not about restoring trust.
Also, for a lot of people, myself included, if your insurance doesn't cover it, you're not getting that vaccine. So if that muddies the water here, that could also prevent access even from people who might want them. I also want to ask you, Republican Senator Bill Cassidy, who is a physician that Kennedy really had to work hard to win over for his confirmation, said Kennedy had promised him he would not do this exact thing. He wouldn't make changes to this committee. Kennedy posted online, of course, now the fear is that ACIP will be filled up with people who know nothing about vaccines except suspicion. He said he's spoken with Kennedy and that he'll continue to talk with him to try to ensure that this is not the case. Is there anything Congress can do to prevent the things Cassidy just laid out from happening? Should it even try?
Yeah, I think Senator Cassidy made a valiant effort in trying to get a set of assurances from RFK Jr. And it's very clear at this point that the secretary lied to the senator and is going back on his word on almost all of his promises that he has made. So that's very concerning. And how Senator Cassidy deals with that, obviously, is up to him. But what I would say at this point for all of us, the main concern is Secretary Kennedy has implemented a multi-step plan to make it much, much harder for people to get vaccines. The issue you raise on insurance is critical. The way it works in America is that when CDC recommends a vaccine, it gets covered by health insurance. If they pull that recommendation, insurance won't cover it. The other key here is if they don't recommend it, the Vaccines for Children program, which actually covers half the kids in America, won't give it. So I'm worried about a future where kids in America won't get the polio vaccine, they won't get a measles vaccine, because our government is no longer going to recommend those vaccines. And that is going to be very harmful for the health and the well-being of the American people.
All right, Dr. Ashish Jha, thank you so much for taking the time.